Hi, I have a question for you today. Who next? Well, for now, it's me again. I got my letter a day and a half ago from the Board of Medical Practice that I'm being investigated again and my medical license is at risk. This time it's because I am showing videos that contain false and misleading information and conclusions. I'm doing videos that falsely compare and minimize the difference between the 2009 H1N1 pandemic and COVID-19 pandemic. And lastly, this anonymous accuser called me a danger to public health. So here I am again. For the last day and a half, I've been composing a response and putting it together for the Board of Medical Practice. I've said this before, if it can happen to me, couldn't it happen to you also? This is a danger, and I think we need to talk about it. Let's not kid ourselves. The cancel culture, the muzzling of a perspective that you don't like, this is happening. But the fact of the matter is, COVID-19 has opened a door into a tremendously vicious political non-discussion. I received an article in a magazine or a journal that I read, the American Journal of Medicine, and in it, Dr. Joseph Alpert talked about a couple of political things from his perspective. He suggested that we have a universal one-week lockdown every year in remembrance of COVID-19. He said, for a week, once a year, we could put on face masks in public, wash our hands frequently, keep the kids at home, perform our work at home as much as possible, and try not to drive or fly. Seriously? He went on to say, following the current pandemic, our next challenge will be dealing with climate change. 2 days ago, we had the top public health official in Canada come out and say that when you're having sex, you should wear a mask. And that the lowest risk of sexual activity during COVID-19 involves yourself alone. I think I remember what that's called. There's an article today talking about what we're doing to kids. The organization PATH, P-A-T-H, came out and said that we may have more than 2 million people die in the first year of pandemic entirely due to causes having nothing to do with the pandemic, but instead dropping rates of immunizations, disease diagnosis and treatment, family planning, mental health disorders, cancer diagnosis, increased domestic abuse, increased child abuse, increased suicide, and simply starvation. It's political. I'm going to deal with the Board of Medical Practice. I'm going to respond, and I appreciate the fact that they have a mission to accomplish. But I have to ask, who are we? This is a time of censorship. This is a time of vehement anger. I want to ask you one question. Do you remember Martin Niemöller when he said, first they came for the socialists and I did not speak out because I was not a socialist. Then they came for the trade unionists and I did not speak out because I was not a trade unionist. Then they came for the Jews and I did not speak out because I was not a Jew. Then they came for me, and there was no one left to speak for me. So even if we think that me or someone else is sort of getting their comeuppance for being such a contrarian or such a skeptic, that it's okay and you might have sort of a quiet, private celebration, I don't think you should. When these things happen, they affect all of us. This is a deep, dark place we're going. And there is a legitimate fear that the cure, the response, is worse than the problem itself. So, am I a danger to public health? And if I am, is it because I'm a skeptic? Or maybe you. Are you a danger to public health? Folks, kids are at risk. Censorship is happening. Please, let's take a moment this Labor Day weekend and ask ourselves, who are we? Thank you.